So I'm going to start recording now. So as I was just mentioning, we're just going to get grounded. We're going to get focused, and we're just going to be still right here, right now, in what we're doing. And what it is, the intention that we want to create is that you guys gain value out of something, and that something actually speaks to you that we go over today. Holistic medicine is a very I would say misunderstood field. And so hopefully this dispels some of the confusion, helps you to gain more clarity, and then also gives you some things to think about. So I'll save some time at the end for you guys to ask any questions, and then we'll go from there. So yeah. So I'd ask you guys to say, how does that sound? But you're all muted. All right, cool. So we'll go ahead and get started. So my name is Dr. Erica Steele, and I've been in the holistic healthcare lifestyle for nearly 30 years at this point, which is kind of wild to even think about because, you know, I'm only like 17. So it's a lot going on. I've been in this field professionally, though, for 19 years. I hold 6 degrees in my field, hundreds of certifications, and they're all specific to holistic medicine. So when I became a doctor, or when I looked at becoming a doctor, I always knew from an early age that I was going to be a doctor. Really, God spoke that into my life. I always kind of knew I was a little different, and I was very bright. And so I'm a writing prodigy. Many of you who know me, follow me, may know that, maybe not know that. But I was really very enamored with words and language at a really early age. My parents were both Marines. My father was a drill instructor. My mother was in medicine and healthcare, and my father was in education. They were divorced. They divorced when I was 2. My mother had me running around labs with her, and at about 8 years old, she had a psychotic break and developed multiple personalities from the trauma that she experienced. And so I went from running around, you know, classrooms and organic chemistry and laboratory, you know, organic chems and labs and things like that they had to do, to now going to my, you know, visiting my mother in mental institutions, etc. But also my mother looked into faith-based healing and really followed her Native American roots. And we started going to vision quests and sweat lodges, and I did Reiki attunements and hands-on healing and acupuncture, all really before the age of 12. And so I've been, that's why I said I've been in this field for a long time, because I grew up, you know, I grew up a vegetarian. My parents were really big into health. My dad was extremely into physical fitness, and so I grew up also working out and going to the gym and understanding the importance of physical exercise and powerlifting and all that kind of, you know, real masculine kind of energy. My dad also, being in education, but his wife at the time was also a geneticist, so I grew up being around that component too. So it was really cool how God just kind of prepared me for what I do today. So I grew up knowing that there was a science that you could prove or disprove, but then also there was this faith-based healing that you couldn't necessarily prove or disprove, but you knew that it worked. And so I suffered tremendously from abuse because of my mother's psychotic breaks. And so at 16 years old, I left my home, and I went out to really work on self-healing and also to go to school. So this really has been a journey. So you'll hear a lot of conversation, and I'm sure those that are kind of attracted to this style of healthcare are really attracted to the journey part of it, because it is a journey, it is a process. There's a step-by-step approach that we take in holistic healthcare, which we'll go into at a later time. But I wanted you to understand, so my life has really been about my own self-healing process, and then about teaching other people how to heal themselves. So when I work with people, it's not just from a place of, this is what I learned from a book and this is what works from a book. In fact, I kind of threw my books out at a certain point because nobody actually fit into the books. I really teach a lot from practical application and what I know that has worked for me. I was diagnosed with post-traumatic stress at 14. And so there was really no other treatment other than medication. And, psychological drugs, they just flatline you. Like you're not high, but you're not low either. You're just kind of flat. You're just existing. And so I was in that era of time where they were medicating the kids pretty heavily. And so it wasn't necessarily about, the family environment or the family unit. It was like, oh, there's something wrong with the kid, let's fix the kid. Which still that phenomenon goes on today, but there was a real wave of it at a certain point. So I kind of got stuck in all of that and really, broke free from that. And, obviously it goes into why I do what I do. So kind of the nuts and bolts of my education. So originally, leaving my home and experiencing what I experienced, I thought, well, why don't I go into psychology? Like that makes sense, right? So I got an AS in psychology, and I stopped because it was really the study of what's wrong with the human condition. And I really didn't think there was anything wrong with the human condition. I just thought that different things happen and the mind can't handle it and can't deal with it. So I said, and I looked at my cohort and I said, this isn't really the right fit for me, because again, remember, I was very God-led to be a doctor. So I actually researched all the types of doctors, allopathic doctors and chiropractors and osteopathic doctors. And I really researched their origins and their roots, and then allowed God to kind of show me and guide me to what I felt like was the best fit for me and what he had for my life, which is pretty cool to be able to have that level of trust. And I really accredit that to my, Native ancestors and also just my upbringing. So I did end up getting a BS in alternative medicine. So that's all the modalities. So understanding, okay, this is homeopathy and this is herbology and this is Ayurveda and this is feng shui and whatever. And then I also got a BS in natural healthcare sciences. So that's more of the biology, the biochemistry. That's like, the provings behind what we're doing. I back that up with a doctorate of natural medicine. Again, that's more expanded on the modalities. I'm primarily a homeopath. So I do a lot of homeopathic practice in my practice. That's more of low frequency work. I do a lot with nutrition and I do a lot with herbs as well, but primarily homeopathy really resonates with me because it's very low frequency medicine. And then I have a doctorate in naturopathy. So I really went more into functional medicine. I went more into integrative medicine, really went really strong in the laboratory diagnostics and the biochemistry. So everything that I do with a person, I can prove or disprove it, and I can also measure it, which makes, really good sense in a day and age that, we want to have data to be able to drive decision making. So it's not just like a theory, I go, oh, well, or generalized study. Like in alternative medicine, a lot of times they go, well, let's see, licorice root is really good for the digestive system. Well, yes, it is. However, how do I know that that person actually needs licorice root? So when I look at their lab work and I can see digestive inflammation in their lab work, then I go, oh, okay, there's a need for licorice root because, you know, MCH or MCHC or MCV is out of alignment. So then that makes sense that licorice root would be a good treatment strategy, as an example right off the top. I then really saw a growing need and a growing understanding for holistic healthcare. And so I ended up getting a master's in public health, again, very God-led and inspired, right? And look at us now, in complementary and alternative medicine. So really, this was more because I knew eventually you know, complementary alternative medicine, as you will, would become a really political, you know, playing ground, and that I wanted to really understand the nuts and bolts behind why they developed insurance and how insurance works and legislation and public healthcare policy and how legislation and public healthcare policy is established, and, you know, what you do in, you know, pandemic, epidemic situations. So lo and behold, here we are, right? And so this year kind of, you know, kicked off with a bang even before COVID. You know, the legislative side of naturopathy and natural health care really was kind of aggressive in this year, and it will just continue to kind of get a little more contentious on that. But I do have that master's, which has come in handy. I also, like I said, I have 100 certifications. I didn't put all of them. I'm like, you know, certified in functional medicine. That was a 2-year postdoc program. I'm certified in integrative medicine. I'm certified in neurolinguistic programming. I'm certified in cognitive behavioral therapies, clinical hypnotherapy. I mean, I can go on and on and on. But, you know, I just kind of gave you kind of the bigger ones that are more important, just to understand, you know, the breadth of my education, my educational background. I love education. I love learning. I am a student of life for sure. So I'm always, you know, expanding my mind. Like most recently, I'm in a feng shui course, actually, which is a deeper, it's a classical feng shui course, right? And it's so funny, you know, because you get to a certain point where you're kind of in a mastery level. And so to start back at a student level again, where like you know, my brain is stretching itself, and, you know, classical feng shui is very complex in a lot of ways. I think a lot of people don't realize that, but, you know, so I'm sitting there trying to figure this out, and my brain's like, oh my God. But it's so good because it stretches my brain past my comfort zone. And so that's, you know, consciousness and expansion and education. So I love that. So now we get into my experience, right? So my experience with people in holistic healthcare. So I came from Southern California. I'm bi-coastal, so I grew up partially in Irvine, California, and then partially here, but I call Irvine my home. So, you know, how they treat holistic healthcare in California is very different than how they treat holistic healthcare in Virginia. So I like to tell people I crash landed here in 2009. What I mean by that is, you know, I came, you know, really at a time where holistic healthcare was not popular in Virginia. You know, we didn't have Trader Joe's, we didn't have Whole Foods, we didn't have juice bars, everybody wasn't a vegan yet. You know, so there was a lot of just confusion, and I was a raw food vegan at the time, and so I was like having my food shipped in. I mean, it was a little interesting time frame. And so, you know, just going out to the networking events, talking to people, I had to finish up my, we have preceptorships, meaning that we have certain amount of clinical hours that we have to complete. So I did that, finish that up while I was here, and with different doctors in the area. And, you know, it was interesting trying to educate the general public about holistic healthcare. At that time, it really was not deeply understood, and we'll kind of talk a little bit more about that. So right now, holistic healthcare and holistic medicine is on trend. It is very trendy. So a lot of people will use that word because it's being used all over. So like, for instance, in some of the Facebook groups, like I see a lot, people are like, oh, does anybody know like a holistic primary care physician? Okay, well, a primary care physician is an allopathic doctor, meaning that they're not trained in holistic medicine. They're trained in allopathy, which allopathy, if you're not familiar with that term, it's Latin for heroic measure. That's your traditional medical doctor or your osteopathic doctor, or your nurse practitioner or your physician's assistant, what you would think a typical healthcare doctor provider would be. So what they're trained to do is to look for and identify and diagnose symptoms, label that as a diagnosis, and then they manage that diagnosis either using a pharmaceutical procedure or surgical intervention if one is available. That is not what we do in holistic healthcare. We don't look at a person in terms of their symptoms. In fact, it's very contrary to what you may think. In holistic healthcare, we view the symptoms as the body's way of healing, whereas in allopathy, they view the symptoms as there's a problem and we need to fix it. And so we actually use the symptoms to help us to understand what the body is telling us. And that's more, that comes from Constantine Hering and Hering's Law of Cure. He was a homeopath in the 1800s and he documented how to cure the body. So there is a lot of misunderstanding when it comes to holistic healthcare. It's not widely understood, I think, because so many people throw that word out there. It's like, you know, massage therapist will say, oh, we're holistic, or a chiropractor will say, oh, we're holistic, or, you know, all these various, you know, weight loss clinics and things like that. They're like, oh, we're holistic because it's a buzzword, right? But there's a lot of depth to holistic medicine, which I'll teach you guys as we go along here. And so I just want to make sure that you understand that over, you know, the course of time, you know, holistic is, that word is going to continue to trend, and you want to be educated so you know what the difference is. So holistic is not just about getting a massage. It's not about getting adjusted. It's not even just about nutrition. It's not about one thing. It's never one thing. It's always a combination of things. It's the whole. That's holistic. Its root is in holism. It also can be very confusing because of that, because it's like, well, I go to yoga. Is that holistic? Well, yeah, it is, because it incorporates that body, mind, and spirit connection. And then, well, I go to, you know, this person, or I'm a vegan. Does that make me holistic? So understand that holistic is a lifestyle. It is a lifestyle and an approach to how we live every single day, right? And so my life, right, is very holistic, right? I meditate several times a day. And I'm not talking like sit on a cushion, meditate. I'm talking about like I have conversation with God all day, right? I'm like talking to him. I'm like, oh, well, what do you think about that? I mean, he's like my BFF, right? And because of that, there's a frequency, there's a creation that's outside of me, that's bigger than me, that I connect in. And so I rest my faith in, and then that calms my body down, that relaxes my body, that soothes my body. And I'm conscious of that. So I'm conscious of, oh, I'm getting like, earlier today, I'll give you an example. So I'm trying to, you know, I'm trying to find a handyman, okay, because I just moved into my house, and, you know, I mean, I guess I could put things up, but, you know, I don't really want to. So I would rather hire somebody to do that, and I'm single, whatever. So, you know, it's been a little bit challenging to get a handyman to come out, and, you know, so I'm finding, and then I don't have a lot of time because I'm with patients. I don't have a lot of time for that. I have time for treating patients. And so I have an assistant who will call and get, you know, and nobody wants to give us a specific quote, and they want to, you know, the whole thing. And I could feel myself kind of getting frustrated because I want to get this done. I want to get this done. I want to get this over. I want to be like, check it off my list, right? But I have to be with that emotion, right? And I don't want to allow it to throw me off course or lose track of what I'm doing, or even just raise my blood pressure or whatever. Like, I just have to be with that. So I'm conscious of the thought of, oh my gosh, I just want to get this done. I'm conscious of the emotion of, that hurried kind of anxious, like, oh God, I just want to get this done, right? I'm responsible for that. And then I'm responsible how that impacts my physical body. So I can catch that because I've been using this muscle for a long time. I can catch and go, oh, okay, you know what? You're pushing, you're trying to control, you just need to let go, you need to breathe, you need to surrender it over, and it'll all work out, right? And so, you know, that is a part of what it means to have a holistic lifestyle. It's not just about the food you eat, the water you drink, the classes you go to, the people you're around. You know, this is not a fad. This is an actual, ancient practice that has been around for a long time. One of the things that my mother used to do when I grew up was she was a nurse, and she did hospice in her home, right? And so being around that energy and that frequency of death and dying was really such a profound experience, because you get to experience what it's like to be with people at all stages of their lives. And of course, I have younger siblings too, so I got to be, a part of that whole process of them growing up. And when she got sick, of course I had to take care of my siblings. And so, I got both ranges, right? And being able to be with all the different ages, all the different experiences, all the different stages of life, and just flowing with it. So there's a lot to it. So holistic doesn't mean that 24 hours a day, 7 days a week, I'm all natural. Okay. So let's say I broke my neck in 2007. And when I woke up from my concussion, I was like, oh, I don't take pain medication, and, blah, blah, cause whatever, I was a little less mellow at that time. I was a little more spunky. So, I was like, I don't want to, and so then the pain medication wore off, and I was like, oh my God, I need pain, so it's not about like suffering, right? Like I don't want people to suffer or feel like they have to choose, right? Like, oh, if I am practicing holistic, or I have this holistic lifestyle, that means that I'm going to throw all my medications out. No, this is a process. This takes time. Like, this is not something, especially where you start from. I was very fortunate that I started really young. And so I've grown up in this lifestyle and raised my daughter in this lifestyle, although she's 16, so she's kind of abandoned it for a moment, but she'll be back. So, there's just a lot to it. And so I don't want you to feel shame or feel guilt or feel, any way judgmental or critical of yourself at wherever your starting point is, right? Like I remember when I first came here, a raw food vegan, right? And I was like cycling 65 miles a week, and I was tiny, and, whatever. And I remember like being shocked at like the diet, the Southern diet, number one. And then two, going, when patients came in and they're like, oh, well, I only ate fast food twice a week. And I was like, yay, like I was really excited because it was showing progress. So, I know this is cliche, but it's really about progress and not perfection. You're never going to be perfect. You're never going to reach it. It's never going to happen. I'm still healing. I'm still, clearing things out and observing things and healing and that sort of thing. So really, it is a process. So I pulled this definition for you. So holistic medicine is the art and science of healing that addresses the whole person, body, mind, and spirit. The practice of holistic medicine, it does integrate conventional and alternative therapies to prevent and treat disease, and most importantly, to promote optimal health. So it's really about education. And remember, we're not treating it. We're not treating, I may have 10 fibromyalgia cases that come in, and they're all treated very differently, because I'm not actually treating the disease. I'm treating the person who just happens to have manifested a disease process. So that's a little bit of a different phenomenon. The condition of holistic health is defined as the unlimited, unimpeded free flow of life force energy through the body, mind, and spirit. So that's that God force that we were talking about. every person has that vital force life energy. Plants have it, animals have it, etc. We all have it. So as I was explaining to you about the death and dying, etc. experience, because I grew up around all of that, I found my first dead body, I think, when I was like, I don't know, 5 or so, walking to the beach. A man had committed suicide, and I found him and, told my parents. And so, you know, I believe that I've had all those experiences to really attune me to vital force life energy. So, when a person comes to me, I can, I've been doing this a long time and clearing myself out, and, I'm a vessel, right? And so I'm really able to attune, okay, you have a strong vital force life energy. Yours is a little weaker. And even with the weaker ones, that's why we use that low frequency work, that homeopathy, to really help, just integrate. Like, I had a couple that came in earlier today, husband and wife. I treat a lot of married people. I treat a lot of parents. I just treat a lot of people. So it was interesting because they've been married a long time, like 50 years, right? And yes, a lot of relationships are. The wife takes the lead and the husband kind of takes the back seat. But the challenge is that the husband is now starting to develop some cognitive impairment issues. So what's happening is he's kind of fading to the background, and they had 5 children. So she's kind of so used, even though they've been retired for a while, she's kind of like, take charge, got to get it done. But what's happening is their energy there as a unit, right? He's slowly kind of fading to the background, and she's kind of supercharging ahead, right? And so there's not a balance in the relationship. I mean, they're great, wonderful, sweet, but if they want to really work on his mind and make sure that his mind stays stable, he's got to come forward a little bit while she's got to dial it back. So it's this balance, of life force energy. I get acupuncture done once a week, and I just love it. It's like amazing. And so that is treating your chi, your universal life force energy throughout your body. Blockages of chi eventually can create disease process. Eastern medicine predates our Western medicine by about 10,000 years. I am a Western-based doctor. However, I use a lot of Eastern philosophy in my practice. Like the foot detox is an Eastern practice as well. A lot of people don't understand it because they're looking at it from a Western view. And a Western is more of anatomy, physiology, biochem. It's more of the masculine hard sciences. That Western medicine, if we can't fix it, we're going to force it kind of thing. Whereas in, Eastern medicine, it's a lot more energetic. That's why I'm like doing the feng shui and going into the energy of my home and all that kind of stuff. So if you could just understand the difference, is that life force energy is more feminine, more healing energy, right? And so hopefully that explains it for you. Holistic medicine encompasses all safe and appropriate modalities of assessment and treatment. Also includes analysis of physical, nutritional, environmental, emotional, spiritual, lifestyle elements. So we look at everything, and we'll kind of go more into it. We also do a lot with patient education and patient participation in the healing process. So it's not about giving your power to me as the doctor and me fixing it. People don't come into my office and dump their problems on my lap and then like, okay, here, I'm going to leave that with you for a while. I'm going to go, back to partying or whatever I'm doing. We're a team. We work together as a team. And so, yes, people come and they dump their lives on my desk, and it's my job to organize them. But it's also your job to take personal responsibility and follow direction. And so, because not everything is as what it meets the eye, and not every symptom, makes sense in terms of what the cause is. Everybody wants to treat the cause, but then when the cause doesn't look like what they want, then it's like, oh no, I'm going to run. So anyway, we'll talk about that more later. So with that being said, some things to consider. So holistic medicine is very safe, very effective. So, and because of my background in Western and my background in the sciences, I'm highly trained in biochemistry. So and also like all the interactions and how this medication reacts with this, supplement, or these medications interact with this, or which medications we can remove when, and, blah, blah, all kinds of stuff, right? Or if we need to have a conventional medication on board, sometimes the purpose of pharmaceutical is to stabilize the person, okay, while we're working on treating the cause. And so sometimes if a person comes in and the disease process is too high, we need a stabilizer for the health of the patient so that, we can work on some of these other core challenges. We tend to go more least invasive to most. We do a lot with patient education and patient responsibility. I teach my patients how to be their own advocates. I teach you how your body works. And I'm also treating the cause, and the cause can be many, 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 many things. It can be mental, emotional, physical, psychosocial, environmental, ancestral. It can be like 1,000 things. And it's usually never one thing. It's always a combination of things, and it's multi-layered. It's like an onion. We also work on who you're being, right? We're human beings, and who you're choosing to be and show up in the world, and who you say you are. It requires a patient willingness, being coachable. So because I'm at the place in my career where I'm not, at the beginning of my career, I was like, oh my God, I want to save the world. Now I'm like, I want to help people who want to heal. Because when I was like, oh, save the world, I mean, it's a lot of energy, because I'm like constantly like working, right? And almost sometimes working more than they're working for themselves, right? And so, I want, and I love working with people who have a willingness to look at the uncomfortable part, and face themselves, and are coachable, and we can work them through a process. There's a deep connection with emotion and authenticity. And my role is really to act as that mirror. So I act as a mirror, and I hold that up so that you can see your ways of being and how they're working and or not working for you. It's funny, I treat a lot of families too. So like mom, dad, kids, whatever. So I have this one family I treat, it's so funny. And so I treat the mom, and I treat the kids, and treated them for years. And the husband came in eventually one time, a few times, right? And he was so scared by that mirror that I was putting up for him to see. He did not want to see that mirror. So, his family still comes in, right? And he he'll come in and like help with the kiddos, because they have 4 kids or whatever. So he'll come in and he's like, oh, hi, doctor. I mean, it's so funny, because he's like, hey, bye, hi, bye, because he's not ready to see that mirror, right? Like that muscle we were talking about, like, I've been doing this a long time. So I'm like, bam, hit me. I want to see it, right? But a lot of people, they're very new to these uncomfortable emotions. They're very new. Some people are shut down emotionally. I mean, gosh, my parents were both Marines. We didn't have emotions. You just shut it down. You shut it all down. Emotions are just not part of the process, right? You adapt and overcome, right? So I love Marines. They're silly people. So, but really, like, that was such a powerful growing experience, learning, relearning, like, what is an emotion? Oh my gosh, that's so uncomfortable. All the survival mechanisms and coping mechanisms and disassociation strategies that I created in order to survive life and not have to deal. I mean, honestly, that's why I have 6 degrees, because I literally was trying to gain my dad's approval and recognition by pieces of paper. So I got this degree, and I got that degree, and I got this. And at 24 years old, after my 2nd doctorate, that was the first time he ever said he was proud of me. And I was like, oh my God, I've waited my entire life for it. Right. And so it was on false footing anyway. But because he has his own stuff that he's got to work through. However, I want people to understand, right, that there is a lot that's involved with holistic healthcare. It's not just like, okay, I'm going to give you some supplements and, run some labs. And I mean, some naturopaths may do that, and that's their practice. And I totally respect that. But as a holistic doctor, as a complete holistic doctor, comprehensive holistic doctor, there's a lot more to it in my practice. And because we're teaching you consciousness. So I'm not just teaching you, like, again, take the supplement, because that's what a lot of times people think it is. It's like, oh, I don't want to take metformin, give me garlic or whatever, I'm throwing stuff out there. There's it's like, okay, so if you have diabetes, right, what are your unconscious and conscious behaviors that are driving you? And is it difficult for you to be sweet to yourself, right? And so then we look at that, right, and we dig on that, and we look, so there's a lot to it, right? It's not just kind of take this or that. So, okay, I'm off the soapbox. So people come in with a wide variety of health concerns. I mean, I treat little kids, elderly people, mid-age people. I mean, I treat all ages. Babies. I think I had like I don't know, 3-month old just yesterday, just all kinds, people that want to start their children off with a holistic practice. So any kind of health concern you can think of, from cough, cold, flu, to diabetes, obesity, hypertension, thyroid conditions, hypo, neurological mental health conditions, anxiety, fears, schizophrenia, let's see, colitis, Crohn's disease, IBS, IBD, all different types of cancers. I mean, I've been in practice a long time, so I've seen a lot, and treated a lot. Wide variety of diagnoses, wide variety of stages on diagnosis, stage 1 to stage 4s, inoperables to operable, chemo, radiation, combination, without, no treatment, slow growing, fast growing. I mean, you name it. I mean, I've seen it at this point. I've seen a lot. Wide variety of lifestyles, people that don't need anything, all the way to people that need everything that's not nailed down, and everyone else in between, right? This one patient I had years ago, she was a young woman, probably in her early 20s, and she was a personal trainer, and she came in, she had like high cholesterol, diabetes, and hypertension, right? And she's a personal trainer, and I'm like, what's going on? So I'm like, okay, bring your food diary in. So she brought her food diary in, and it's like McDonald's and, Taco Hell and like all this stuff, right? And so I go, well, what's going on with your diet? Come to find out, her parents were farmers. And so one of the things, they have the plate at the table, or whatever. And one of the things was, is like, you can't get up off the table until you've cleared your plate, kind of thing, right? And so she would sit, and she didn't like some of the food, so she would literally almost sit overnight at this table in front of this food that, like, she just wouldn't eat, right? So when she became an adult and she moved out of the house, she goes, I'm never going to eat a vegetable ever again. And so she began her life on like a fast food diet, and whatever she wanted to eat, whatever tasted good, that's what she ate. So of course, if you do that with every single meal, eventually you're going to develop some of these metabolic diseases. So, she came to me from a referral from the doctor. And so, we're talking and we're going through this and we're discovering this and we're peeling back all these layers, right? And within a year, she's off all the medication, she's reversed everything, and she's doing so much better. And so that's the root cause, right? Had I would have treated her like every other hypertension case, but you would never get that transformation. And also too, she's leaving the practice not on a ton of supplements either. You can't replace a pharmaceutical for a nutraceutical. The body was made to heal itself. And if we give it the right environment, it will and can heal itself. And so it's not about replacing what the body can do. It's about supporting it. Wide variety of experiences. I've had people that have been homeless, battered, abused, uh I mean, you name the experiences. Good families, great families, horrible families, transient, all different types of backgrounds, all different, international. I've worked with people from all different backgrounds, from Middle Eastern to Hispanic to Indian to all different types of backgrounds. I mean, you name it. I've European, all kinds of. So variety of different needs. Some people, it's like, okay, I want you to fix this. Some people are like, I want you to fix my kid. Some people are like, I want you to fix my husband. Like all kinds of different aspects, right? And so we gotta like pump the brakes. I'll give you an example. I have this great case. I love her so much. I treat her whole family. And so she came to me and she was convinced that it was her husband. She was absolutely, it was her husband and her kids. And if her husband and kids could stop driving her nuts, she would be fine. Right. And so, it was a process of like, leave your husband alone. Stop picking on your husband. You got no. And she's like, and she would, she was a holder on her too. So she's like, no, you don't understand. Yeah. Anyway, so a year and a half it took. She's, like I said, she's stubborn. Year and a half. Finally, she came in today with her daughter, and her little daughter's so sweet. And she's like, we have the best marriage we have ever had. We're at 7 years. We're doing amazing. He's almost to the point of moving back into the bedroom, Like, but it goes to show you, right? Like all the different needs and all the different experiences. We also have a wide variety of expectations. So people come in with the same allopathic brain of, okay, I'm here to treat XYZ disease, or I'm here to treat, I'm here to get a supplement, or I'm here, and so understanding that this is so much more than just that. I've helped people through addictions, divorces, marriages, relationships, parenting, death, grief, abuse, trauma, fear, anxiety, mental, emotional, any kind of physiological problem that you can think of. And I've treated over 30,000 people, primarily families, since 2009. So a lot of people. A lot of human. I'm so fascinated with humans and the human experience. Most people come into my practice because of a physical issue. They're like, oh yeah, it's just my thyroid. Oh yeah, it's just my whatever. And then we start to get an environment, so lifestyle, toxicity levels. We look at, genetics, epigenetics as well, but we look at relationships. Then it gets into the mental side of it, the subconscious, conscious mind, the limiting beliefs, the core beliefs, the defense mechanisms, the ego, all the toxic emotions. And then, as we talked about, all the emotions, the things that have been stuffed, stored, not processed, not dealt with, all those emotions that have been buried. Feelings buried alive never die. They just manifest disease. And so that's part of my training is in psychoneuroimmunology. I think I have one more degree left in me, and that will be a PhD in that particular area in mind-body medicine. So I don't know, not anytime soon, but maybe before I leave this planet. And then once we clear this stuff, a lot of times it opens a person up to spirituality, to really connection. So I'll give you an example of a lady that I treated. She came in for a thyroid condition years ago. And she's still my patient. She's like, I'm a lifer. And so she came in with a thyroid condition. And lo and behold, as we're kind of working through the process, we find out that her husband, they've been married for 25 years. Her husband's an alcoholic. She's been tiptoeing around. She's been managing all of that, working through all that. They have kids. I mean, just in a state, the throat chakra, like not being able to express and communicate, right? And so we worked on the physical, we worked on the environmental. She ended up, leaving, separating, divorcing, etc. Mentally clearing herself out, right? Mindset stuck, what was kind of driving her to these unhealthy habits and this unhealthy environment, emotionally processing through all the grief, the anger, the hostility, the judgment, because she was totally shut down when she came in. And then emotionally, being able to break free and be clear. And now she's like so in tune and so just, connected. And now she's just really processing and healing. And now we're getting into some deep ancestral, breaking free from the ancestral traumas, breaking cycles. Her father was an alcoholic, so it was kind of passed down. So breaking those cycles as well is super important. And that's a real part of healthcare that I believe is missed a lot of the times, to be able to, clear those things out, because they really don't serve us. All right, let me see if I can, okay, let's see, perfect. All right. So just to recap, holistic medicine is really that whole person view of the human experience. It's an integrative approach to healthcare. So I work with allopathic doctors all the time, so it's not us against them. We work together for the benefit of the patient. A wholehearted approach to healthcare. So, I really have had to work on myself, process all things out of and to really be wholehearted, to be able to receive people and love them unconditionally, deeply, and completely. And that was really kind of how I felt about humans, even from day one. And I did a loving and very gentle approach to healthcare. Now, don't get me wrong, I am tough in some respects, especially when that ego starts to kind of resist and it doesn't want to shift. And, I have to take some stands at times, because otherwise, if you give into the ego, the person will stay stuck. And so we really try to create a solid coaching relationship. And then an educational approach. So definitely educating and helping a person understand, but at the same time understanding that you don't have to understand everything for everything to work. So that it's a coping mechanism that some people get, is like they got to figure it out, they got to know, they got to understand. And so sometimes it's just about surrendering and just being with the experience too. All right, so I think that covers most of it. I wanted to kind of go over a little bit about holistic family practice, right? So we are a private practice. We're not corporate. Well, we are a corporation, but we're not corporately owned. It's privately owned. It's my invention, if you will. I do offer DIY, which are short-term care plans. Those are plans where somebody comes in and they just need really 1 or 2 visits with me to kind of show them this, show them that, and they're pretty self-reliant and they're good. Concierge is more for long-term care. So those are people that really need a lot more hand-holding and working them through the process of healing. Maybe they've got diagnoses of sorts, or they've got really bad lifestyle habits, or they're just really stuck. So we work with them through their technology. I use a lot of technology in my practice. We have meal tracking apps. We use body composition devices. We have a scale here that you get on. You get visceral fat, your body fat index, your metabolic caloric rate. We use a lot of metrics in our practice, a lot of data. Even our health history form or software, it aggregates data and puts it into a timeline format for us to be able to find causative. So we are a high technology practice. We use a lot of technology to help make it easier for you and us. I also am a virtual practice. So we keep my actual physical practice really very minimal. I try to upload the videos for a virtual tour. I apologize, I couldn't quite figure it out. Ironic with all the technology, right? But I use all virtual assistants. And so the only person that's actually here with me is myself, and also too, any of the other practice members that are here. We do keep it very low, especially because of the personalization, and also, because of what's going on. We don't have a lot of people in the practice all at the same time. So it's very private. I work locally as well as internationally. I am America's holistic doctor. I'm in the media a lot, and so I do education because of my training and expertise in holistic medicine. There's not a whole lot of people out there that are solely trained in holistic like I am. And so it's an emerging practice, which is really, really cool. And then the last slide before we get into questions is steps to our practice. So if this resonates with anybody, we schedule consults. Usually I do 15-minute complimentary consults or 60-minute consults. I don't accept insurance for my service fees because I want to work for you and not your insurance company. Early on, I took insurance and it was a zoo. And so I don't do any of that anymore. And for good reason. It's a lot of paperwork, not a lot of yields. The insurance companies want you to jump through 1,000 hoops. The hoops don't really make a whole lot of sense. It puts strain on you, strain on me, and it's just a no-win. I do make it very affordable though, because of that. Lab work, we do accept insurance for, and I usually do lab work. We do draws here. We'll send you to LabCorp. Just depends. We use current or 4 months or less. I review your lab work, which that leads to me coming up with a 30-page report, and I go over your lab work in detail. And then I review recommendations for you and a treatment plan. And I'm really upfront and honest with you in terms of pricing, in terms of how long it's going to take, obviously with your willingness, and just kind of give you the straight on it. I'm not in this for money. Dear God, I would have quit a long time ago. Although I'm very successful now, it's definitely been a journey for sure, bringing holistic healthcare to this area. And because of that now, it's catching on, which is really cool. And so treatment plans are, they are all kinds of ranges and all kinds of different scenarios. So, and that's pretty much how it works in my practice. I'm going to open up the floor if anybody wants to ask any questions about holistic practice. If you'll just unmute yourself, and I'll spend a few minutes answering any questions you may have.
I have a question.
Mm-hmm.
Yeah. I was recently diagnosed with fibroids.
Okay.
I was wondering what advice you had to treat this from a more holistic standpoint.
So any kind of tumors, masses, anything like that, typically it comes as a toxicity, right? So again, we want to look at energy in, energy out. So we want to look at the diet. We want to look at what you're eating, what you're digesting, what you're assimilating. A lot of times, fibroids, there can be a not a detoxification, there is a detox issue, but sometimes it can be a breakdown issue. So proteolytic enzymes can be helpful and have been shown scientifically to help with the breakdown of fibroids. It's not a fix per se, because you want to look at some of the underlying things, but from a supplement perspective, proteolytic enzymes are helpful.
Okay, I'll look into that. Thank you.
Yeah, thank you. Oh yeah, and I would do castor oil packs as well. Just rub castor oil on your tummy and a towel and a heating pad, because the essential fatty acids, which a lot of times because the liver is toxic, it can't get in, and so that can help soothe the area, lower inflammation as well. So just thought
I also heard of like milk thistle, and there's something called fibroid defense. Just I've seen a bunch of different supplements online. I don't know if
yeah, so milk thistle is a pretty generic herb. I don't reach for milk thistle a lot because we're in the nutraceutical world. So allopaths have pharmaceutical reps, we have nutraceutical reps, so it kind of helps you to understand the difference. But yeah, proteolytic enzymes are your better bet for that. So, look at the combination, whatever it is, make sure there's no filler in it, make sure there's no coloring food dyes, because sometimes with retail supplements, they put all kinds of crazy stuff in it. So be mindful of that. Don't buy it off Amazon, buy it directly from the actual manufacturer. So take the third party out. Amazon has all kinds of craziness with supplements. So yeah, go directly to the manufacturer. And proteolytic enzymes. So a lot of times with those fibroid blends, that's the agent that they're using to break down the fibroid tissue.
Got it.
Yeah, cool. Thanks. Any other questions?
Yes, I have a question.
Mm-hmm.
I've been diagnosed with tendonitis a few months ago. I'm in the Navy, and they were treating me with occupational therapy. I am currently going to school, so I'm unable to continue going. They wanted me to continue going, but since I can't, their next step is cortisone shots. I don't want cortisone shots, so I want to know if that is something that you are able to treat naturally.
So your reception is a little kind of wonky. It's a little, it's not 100% clear. Did you say tendonitis or tinnitus?
I'm so sorry, I didn't hear you.
Did you say, yeah, it's a little choppy, but did you say tendonitis or tinnitus?
Oh, tendonitis in the thumb.
Okay, so tendonitis. So inflammation of the tendon. Okay. So, yeah, so you're going to look at the source. So inflammation is always a response to something in the body. Okay, so we ask ourselves, what is the body responding to? Is it infection? Is it heavy metal? Is it chemical? Is it repetitive use injury? What is it? Right? And so there's twofold, right? The cause is finding out what is driving the inflammatory process, number one, right? Is it diet, whatever it is? That's the first part, working on that. But then in terms of the symptom, right? So we look at inflammatory things, right? So general things are like high dose curcumin, curcuminoid systemically, CBD, but if you use CBD, it has to be a high milligram, like a 1,500 to 3,000 milligram dose, which is hard to find in a retail market. And so you would use that for systemic lowering inflammation, and then also combine it with a topical at the same time, because systemic anti-inflammatories are just going to kind of go wherever. But if you couple that with a topical agent, like this, another topical agent would be something like peppermint or something like that, as in that particular area. Essential fatty acids are always a great option with that too. So it's really a multi-pronged approach. So you're treating the symptom, and then you're trying to figure out what the cause is. So you know, to long-winded answer your question, yes, I have a lot of experience with that.
Thank you.
You're welcome. All right, any other questions? All right. Well, I think we covered it all. We like solved the world's problems in a whole hour. I love it. Well, thank you guys so much for attending. I really, really appreciate you. I hope that this was informative and educational, and you learned a little bit more about the depth of holistic practice, and you look at life as well as your body, your mind, and your spirit just a little bit differently. And so I'm going to, after it processes, I will post it on our YouTube channel. So feel free to check out our YouTube channel. I'll also post it on our Facebook page as well. And so you'll be able to reference it and see all of the wonderful, you know, information in it. So.
Actually, I had a quick question
yeah.
about menopause. I forgot.
Okay, got you.
Yeah, sorry.
No, you're good. What do you want to know?
No, just wanted to know, you know,
kind of treatment
yeah,
strategies.
clients. Yeah.
Yeah. So it depends. So a lot of times with menopause, so believe it or not, a healthy person, right, has no symptoms of menopause.
Okay.
I know this is crazy. Right? So if there are symptoms, right, we know that there's something going on. We know that there's an imbalance. So the imbalance can come from minerals. It could be from adrenal glands, because the adrenals will throw everything off. It can come from internal stress, infections. Majority of the hormonal system is housed in the digestive tract. Evening primrose is great. Krill oil is great. great for like hot flash symptoms. There are a lot of combination products that can be good, black cohosh, and then also too, like if let's say the DHEA is too low, you want to elevate the DHEA. If the progesterone is too low, Vitex, I think it's called, that's been really helpful for it herbally. So it just really depends on what the symptoms are, and then of course what the overall health of the person is.
Okay. So obviously come in and do a test with you, right?
Exactly, blood work, and then if we need to do hormonal testing, I can. We do, gold standard in hormone testing is saliva, so we would do a comprehensive saliva test, to see what's going on with the hormone.
All right. Thank you.
There's a lot of different things.
Okay, thanks.
Thank you.
That's it for me.
All right, my last call. Any other questions? Comments, concerns? All right. Well, you guys have an amazing evening, and thank you so much again for participating and learning more. Bye.